This panel on rural mental health is a very important panel from our perspective, especially on World Mental Health Day. It was almost a no-brainer for us that mental health issues in general are so prevalent right now and becoming more and more we're becoming more and more aware of them. And there's also been a lot of work done around rural mental health. And so it was important for us to have this panel. So we're actually going to change the order a bit from what is in your program. So we're going to have Karen speak first, then Megz, and then Duane. But what I'm going to do is I'm going to read their bios for you a little bit. I might abridge them somewhat. But I'll start with Karen. Karen is a developmental psychologist, graduated with a degree in developmental psychology at the University of Manitoba. And her doctoral degree is in clinical psychology from the University of South Dakota. She was an associate professor in the Department of Clinical Health Psychology at the University of Manitoba for 17 years. And she is she founded the Rural and Northern Psychology section of the Canadian Psychological Association and continues to be an active member. She was the 2012 recipient of the Canadian Psychological Association's Award for Distinguished Contributions to the Profession of Psychology, and the 2018 recipient of the Rural and Northern Psychology section's Award for Distinguished Professional Contributions to Rural and Northern Practice. Karen currently has a private practice office in Oakbank, Manitoba, where she continues to offer assessment and treatment services to individual clients, as well as consultation and continuing education to health providers. She has two wonderful stepchildren, and resides with her supportive husband in Ile-a-la-Crosse, Manitoba. Megz grew up in Calgary, had an 11-year career with the Western Canadian film industry before meeting her husband and moving to Saskatchewan. That happens, doesn't it?
I don't think very often.
You'd be surprised. Megz jumped right into farming, not only working as an apprentice heavy-duty mechanic at the local AGCO dealership, but also learning how to be a grain farmer. She quickly realized that she was extremely passionate about agriculture and rural life. In the past couple of years, Meg has been working hard to advocate on behalf of producers. She has recently taken a rep position with the Agriculture Producers Association of Saskatchewan, working on policy files to improve Canadian agriculture as well as rural life. She is also striving to help end the stigma surrounding mental health in agriculture, and by sharing her own experiences with stress and their challenges that come being a producer. Megz currently farms with her husband and their two little girls outside Kyle, Saskatchewan. Together they are tackling life and farming while working hard to make a difference. And our last speaker today will be Duane Favel. And this is really fun for me, because he's giving me a bio, but I get to tell you the real story. Duane, I count as a colleague and a friend. Duane was born and raised in the historical Métis community of Ile-a-Crosse. He attended the University of Saskatchewan, where he received his Bachelor of Education degree. He went on to teach for the Greater Saskatchewan Catholic Schools, where he spent 15 years. He's currently serving his 4th term as Mayor of Ile-a-Crosse. His long-term vision is to have safe, healthy, stable, and sustainable communities in northern Saskatchewan. And what Duane didn't tell you is that he's a former stand-up comedian. He lives to harass his local MLA. And he is a tireless advocate for the North and for his community. And he is all about collaboration and partnerships. So I'm going to call on Karen to start us off.
Nice to see so many people interested in this topic, and thank you very much for the invitation to come and be part of this panel. What I had intended to do was just do a bit of an overview of mental health and mental illness in Canada, and then talk a little bit about specific issues that come up in rural and northern communities. And if I have a little bit of time, I'd also like to talk about the program that I used to be the director of in Manitoba, and their efforts to train and recruit and retain psychologists in rural and northern Manitoba. So please keep me to my time because I am notorious for babbling on. So I'm just going to start with some general information about mental illness in Canada, because a lot of the information I'm going to be talking about with respect to rural and northern communities kind of makes reference to this and comparisons. So it's estimated that roughly 1 in 3 Canadians will experience mental illness or an addiction issue in their lifetime. Men seem to have higher rates of addictions, and women seem to be presenting more so or being diagnosed more with mood and anxiety disorders. There does seem to be an association or a link between socioeconomic variables and mental illness. For example, kind of the lowest, individuals in the lowest income bracket are 3 to 4 times more likely to report poor to fair mental health compared to people in the highest tax bracket. We also know that there's a link between mental health and physical health. Individuals diagnosed with mood disorders are at a greater risk of later being developed with a long-term medical condition. And the reverse also seems to be true. People diagnosed with a long-term medical condition seem to be at a higher risk of developing a mood disorder. Mental illness is a leading cause of disability in Canada, and it's estimated that the economic burden of mental illness is over $50 billion per year. In terms of suicides, roughly 4,000 Canadians die by suicide each year. The good news is the numbers do seem to be decreasing since 1983, so there seems to be some small improvement in the number of people dying by suicide. Approximately 50% or more of the suicides are occurring in people 45 years and older, but our young population is absolutely affected by suicide. You can see there that depending on the age range, anywhere from 19% to 29% of deaths in 2016 in these various age groups were related to suicide. The mental health and mental health needs of the Indigenous population of Canada is a complex situation, and it's I think widely recognized that the overall health and wellness of Indigenous Canadians has been greatly impacted by colonialism, residential schools, and other oppressive historical acts. There is quite a significant number of Indigenous peoples living in rural and northern communities, so I did want to provide just some very brief information about some of the research in this area. I'm sure Duane will be providing additional information from, of course, his unique perspective. Some of the studies looking at mental health in individuals identified as First Nations living off reserve report higher rates of distress and depression relative to other Canadians. Studies done with the Inuit or surveys done with Inuit suggest lower rates of depression for that population. Interestingly though, Inuit youth's risk of suicide is 11 times the national average. So I think what those represent is perhaps our inaccurate understanding of mental health and wellness in Indigenous populations, and perhaps our inability to really capture what's happening for those populations. First Nations youth as well, rates of suicide are 5 to 6 times the national average. I think this information's been quite available in the media. One thing that I think is really important to highlight is the amount of control that a First Nations community has over its own affairs seems to be related to mental health. So for example, suicide is much less common in First Nations communities that have cultural facilities. that manage their own health, education, and police services, that are actively pursuing self-government and control of their traditional lands. So I'm going to move on to rural Canada. Probably a lot of this information is well known by all of you. So kind of depending on how rural is defined, anywhere from 19 to 35% of Canadians reside in rural areas. The proportion of provincial population residing in rural and northern communities certainly does vary by province, with Nunavut and Prince Edward Island having one of the highest percentages of their population living in rural and northern communities. Over 40% of Indigenous peoples live in rural areas. There's also some information regarding some of the socio-demographic and economic factors comparing kind of rural and urban communities. And it's really important to recognize that as I'm presenting some of this information, it is summaries across Canada, and certainly each community is unique, and there's great diversity across rural and northern communities. When we look at kind of the more national data, though, it does suggest that individuals living in rural and northern communities often have poorer socioeconomic conditions, lower educational attainments, less healthy behaviors, higher overall mortality rates, and that seems to be driven up primarily by motor vehicle accidents, injury, and deaths by suicide. Many rural communities also have an older age distribution of older people. There are certainly exceptions to that. In Manitoba, some of our northern communities, the opposite is true, actually. Their populations are much more overrepresented by younger people. Probably one of the most comprehensive surveys that have been done looking at differences between rural and urban Canadians and kind of how healthy rural Canadians are was done in 2006, so it is quite old, and unfortunately still seems to be the reference point when we're looking at mental health for rural Canadians. I should mention that these surveys did exclude certain individuals in Canada, and it's important for us to be aware of that. So these surveys excluded individuals living on reserve land, crown land. It excluded individuals living in institutions, as well as full-time members of the Canadian Armed Forces and residents of certain remote communities. So it's important that we look at this data with that in mind. For the most part, there seem to be comparable prevalence of mental disorders when we're looking at this data set, rural versus urban. There seem to be some strengths associated with rural life. Individuals living in rural communities often report a stronger sense of community belonging, and they're less likely to report low self-esteem and high levels of stress. When we look at just the general population, it's often reported that there's kind of comparable levels of intimate partner violence compared to rural and northern areas, or rural and urban. There seems to be comparable cannabis use in individuals 15 and older. Some information suggests rural students, though, are more likely to use alcohol, binge drink, and drive after drinking or using cannabis. And there is some conflicting research looking at rural versus urban differences with use of other illicit drugs. The conflicting information regarding suicide is related to whether you're looking at suicide attempts, thoughts about suicide, or death by suicide. As I mentioned, death by suicide does seem to be higher in some rural and northern communities, and youth seem to be particularly at risk in these areas. I did want to look at a few studies looking at more specific populations to highlight some of the differences that can exist when we're looking at different populations. There's some evidence to suggest that Aboriginal women living in rural areas are reporting higher rates of intimate partner violence. And there's some suggestion that kind of the opposite is true for non-Aboriginal rural women. One survey done with First Nations people in Canada in, I think it's 2003, the majority of individuals on that survey reported feeling balanced physically, emotionally, mentally, and spiritually. One study in Quebec found higher rates of depression in older adults living in rural versus urban areas. And despite kind of this national survey that's telling us that rural Canadians are less stressed, one survey that specifically targeted farmers found that may not be true. Actually, 2/3 of Canadian farmers in that study reported feeling stressed and 20% reported feeling very stressed. There are certainly a lot of barriers to accessing mental health services in rural and urban communities. Often they have limited local resources. The resources they do have may not be culturally appropriate or available in that individual's language of choice or first language. Historically, there have been issues, particularly with the Indigenous population, regarding jurisdictional issues and provincial funding, creating some challenges for collaboration. Lack of public transportation is often identified as a barrier, as rural and northern Canadians often need to travel further to access services. And because of that, it's more costly. So people are needing to take more time off work to attend an appointment. They may need to get child care, pay for gas, etc., which urban Canadians may not experience. Stigma and lack of anonymity is often raised as a barrier for individuals in smaller communities. Communication issues is another area that's been identified. And when they talk about communication issues in the literature, they talk about it in a very broad sense, that healthcare providers aren't communicating with each other. They're not communicating effectively with families and with communities. So it seems to be kind of a communication breakdown at multiple levels. Self-reliance is often kind of cited in articles around rural and northern individuals that they pride themselves in being kind of independent and self-reliant and wanting to manage things more independently. One study with farmers in particular found that pride and independence were the primary reasons farmers gave for not accessing help. We did a survey in one of the rural health regions I used to work in, and we found similar things. People saying either the problem wasn't bad enough, which is too bad because we want people to come before it gets too bad, or they're concerned about other people finding out that they've accessed services, and cost was identified by folks in our region as well. Sadly, psychologist availability in rural and northern communities is also an ongoing issue. If we look at kind of Canada as a whole, there's approximately 48 psychologists per 100,000 Canadians. 4% have been self-identify as working in non-urban settings. The access to psychology services really does vary from provinces. Quebec tends to have the highest proportion of psychologists, and Manitoba is one of the lowest. So as you can see, 19 psychologists for every 100,000 Canadians. And when we look at the rural health regions in Manitoba, we're looking at kind of 1.5 clinical psychologists per 100,000. So those are the health regions as they're kind of divided up now in Manitoba. I did want to just mention quickly the program that I had been involved with for quite some time. It's at the University of Manitoba Department of Clinical Health Psychology. They started a rural and northern psychology program in 1996 with the goal of increased access to culturally appropriate, evidence-based psychological services. It started with 3 psychologists being hired into the positions, 1 in the northern region, 1. And I covered Interlake Eastern and about half of what's the southern region. Since that time, due to collaborations with government and health regions, the number of psychologists in rural and northern areas in Manitoba has gone from 3 to 10. And as of 2016, we've trained 43 residents. They complete a 6-month specialty rotation in rural and northern psychology. And those residents have actually been a very positive force in us maintaining psychologists in our province in rural settings.
Thank you for having me. This is a topic that's near and dear to my heart. And when I was asked or approached about this, I jumped on board and then thought, when given the information that we would be doing kind of a 15-minute presentation at the beginning of the panel, I wasn't quite sure what to talk about. And last week I had the opportunity to witness in front of the standing committee in Ottawa about mental health and agriculture. And I think reading what I read to them is probably a really good way to start this off. So I'm going to skip part of the beginning, since that was in my bio, that I grew up in the city. I'm not from a farm. So I'll just jump in and say that moving to rural Saskatchewan and becoming a grain farmer, it didn't take me long to figure out how challenging, stressful, and isolating farming can be. 2016 may have been my 4th year farming, but it was the first time I stood and watched while my crop, literally almost $500,000 worth of crop, was destroyed in a 10-minute hailstorm. It was also the first time in my life that I felt like a complete failure. A failure as a farmer, a failure as a spouse, and a failure as a provider for my family. It was the first and sadly not the last time that I felt my only worth to my husband and my little girls was in my life insurance policy. I would love to stand in front of you all today and say that things are better, to say that I'm the only one in Canadian agriculture who has ever felt this way, but to do so would be a lie. We are now experiencing our 3rd year in a row that's challenging. Weather extremes are sabotaging our ability to grow the bushels we need to try to make a profit. Commodity prices are not coming close to covering our expenses, and transportation issues inhibit our ability to pay our bills on time. I no longer know what it feels like to live without stress, and my husband now struggles with anxiety triggered by the stress of trying to farm and make ends meet. An anxiety I've watched bring him to his knees sobbing. If you asked me in this moment if I hoped my girls would grow up wanting to take over our 4th generation farm, I would tell you I hope they will want to do anything but become farmers. However, the stark reality is that if we continue on our current path, there will not be a farm for them to take over one day. Right now, I'm sure you're thinking that we must be bad farmers, or that there must be something wrong with our business plan. Because after all, the point of a business is to balance risk and expenses while still turning that profit. Do you know that grain farmers in Canada have the 2nd highest costs of inputs globally? So that is our seed treatment, chemical, fertilizer, everything we need to grow that crop. We also cannot come close to growing the bushels that other countries can grow because of our growing climate, so the moisture we receive, how dry we are. And on average, the bushels that I am able to produce, they're not going to cover my expenses, including the cost of my land mortgage or rent. So most of us are working off-farm jobs in order to be able to afford to farm. So I need to work off-farm, not only to put food on my family's table, but in order to afford my farming bills. If I was working as a nurse, a teacher, a banker, or if I still worked in the film industry, I would not be required to hold a 2nd job to pay for the expenses from my 1st job. One of the extremely challenging aspects of farming, aside from not being able to control the weather, is my inability to set or control my end prices. So I have 0 control over being able to raise my price at the end to say, okay, my expenses went up, we had some really crappy weather, we were in drought this year, I need to make more on the end of that to sell my grain at a higher price. I can't do that. I have 0 control. I have to try to get a contract that is going to hopefully help cover my bills. I'm also usually forced to try to sell that crop at a time when there's pressure, markets are lower from harvest. In February, I sat in a room full of 400 producers. We were tasked with standing up when a question asked applied to us. The first question was, have you ever lost a family member or a friend to suicide? Approximately 90% of the room stood up, and that broke my heart. Farmers, not only in Canada, but globally, are struggling. We're struggling with high levels of stress, anxiety, and depression. We cannot speak out or admit that we are struggling because when we are told to be strong, we're told to suck it up. We're told that we are not real farmers if we ask for help. If we seek help and treatment, we might be turned down for life insurance policies or watch our premiums skyrocket. Because life insurance companies classify us as a higher risk when we are actually seeking to take care of ourselves. We run on 3 to 5 hours of sleep during the busy seasons like seeding and harvest and go for weeks without seeing much of our families and children. We spend 15 hours a day plus in equipment cabs by ourselves, in isolation, running the numbers, worrying about getting further into debt and getting stuck basically in our own heads. Sometimes we also have our children with us because we don't have access to daycare in rural areas, and that's another fun challenge. Often we're also volunteers in our communities as first responders, and we deal with being on the scene for accidents and the deaths of our family members and friends. This summer, a friend posted that a farmer in her community had just died from suicide. I did not know the person, but I broke down sobbing at my kitchen table. When I took a moment to reflect as to why the death of someone I did not know upset me so much, I realized that I was forced to bring light to a fear that I don't want to dwell on. The fear that surges up when I cannot get a hold of my husband. The fear that just possibly he is given into the nonstop stress and anxiety of trying to provide for our family and farm at the same time. The conversation is starting to change. Producers are starting to open up, but it is only the start. Stigma surrounding mental health in agriculture is still strong. We need support from each other. We need support from our communities, services from our healthcare systems, and we need to be able to afford to farm without having to rely on off-farm incomes. So some stats from the survey that was just done in Wolf and published last year is that 35% of farmers are living with depression. 40% of those farmers will not seek help due to the stigma surrounding depression and mental illness in agriculture. 45% of farmers experience high stress every day, and 58% of farmers are living with anxiety. So how do we provide help in rural areas? If I break my hip, there's going to be a meal train set up, and there's going to be food that comes to my family. There's going to be farmers that show up with their equipment to help me get my harvest off. But if I'm suffering from depression or a mental illness, nobody knows how to deal with that. People don't know how to recognize that, and people don't know how to help or try to be there to support you without worrying about offending you. So we need to bring mental health first aid into communities so that people know how to recognize when their neighbors and their family members and their friends are suffering, but they need help. Because right now there are a lot of people in rural areas that don't even know that the term mental health is something that we deal with every day, and that's a sliding scale, and there's a lot of factors that affect that. Yes, we need access to psychologists, but they're part of that stigma is that you can't just bring them into the community. They can't be a community member because I'm not going to go to them. I don't want to air my laundry. I don't want someone to know that I'm going to that person. So we need to somehow set up something where we can access these people through our smartphones, through our iPads. The times when we need to be able to reach out and talk are the times that we're stuck in equipment cabs. So we need to work around using the technology that we have to bring support and resources to communities and to agriculture. As a firefighter, I can get access to see a psychologist within a couple of weeks by going through a separate system. So we need, I think, something like that in our rural communities where that has been prioritized, because otherwise I'm looking for maybe 4 to 5 months wait, and then I'm driving 2 hours to get to a community where I can see someone, and that's, no farmer is going to do that. They're not going to commit that time, because usually when you need it, you're too busy, and by the time that appointment comes up, you're moving on to something else. So I appreciate being here, and I really I'm thankful for all of you listening to me today, and I would love to answer any questions after.